Hi, my name is Rachel Sage McCafferty, and today I'm going to be demonstrating a full health assessment on my patient. So the first thing that I'm going to do is check my orders, and then I'm going to gather my supplies. I have my supplies gathered over here. I have a stethoscope, a cotton ball, a pencil, I have a pen light, and then I have some oil of lavender as well as some gloves for personal protective equipment. So after gathering my supplies, I'm going to wash my hands. I'm going to come into the patient's room and I'm going to pull the curtain for privacy and I'm going to introduce myself. Hi, my name is Sage and I'm going to be your nurse today. Can I please have your name and date of birth?
It's Ransom McCafferty in February 17th, 2000.
Okay, I'm going to double check with this bracelet and that is accurate. So after that, I'm going to explain the procedure. Today I'm going to be giving you a complete health assessment and it should take about 30 minutes.
Okay.
And then I'm going to raise the bed up to an appropriate height and then we're going to go ahead and get started. I'm going to go ahead and put on my personal protective equipment. So the appearance of my patient, he appears calm, he is sitting erect, all of his movements are voluntary and well coordinated. He appears calm, his affect is appropriate to conversation, and he smiled appropriately whenever I introduced myself. So next I'm going to move into a mental status exam. What would you do if your house was on fire?
Leave immediately.
Okay, that is going to test his judgment. Next I'll test his orientation. So do you know what time of day it is approximately?
I think it's about 4:30.
Okay, and where are you currently?
I'm in Indianapolis, Indiana at your apartment.
All right, and who's the president right now?
Donald Trump.
All right, and why are you here?
To get a health exam.
All right, and then for memory, I would have given him a set of words at the beginning to recall, and then he would recall those for short-term memory. For immediate recall, can you repeat this phrase after me? All pigs go to heaven.
All pigs go to heaven.
All right, that tests immediate recall, and can you tell me the date of birth of your youngest sibling?
I am the youngest sibling, but...
Your half-brother.
Okay, Kale. July 25th, 2015.
That is all correct. So that tested his long-term memory. And next, his attention span. Is he able to follow a set of directions without a break in attention span? And he would be able to do that. And then last, his speech. His speech is clear, coherent, and has an appropriate rate and tone. So that does it for mini mental status. Next, I'll move into the cranial nerves. So the very first cranial nerve is number 1, olfactory, and this I'm going to be testing the patency of his nose. Can you plug one nostril and close your eyes and tell me what you smell?
Lavender.
All right, and plug your other nostril, keep your eyes closed.
Lavender again.
All right. While I'm here, I'm going to just check all of his nose. His nares are symmetrical. There's no exudate, the mucosa is pink, and there's no obstructions. Okay, next is next is the optic nerve, cranial nerve number 2, and this is going to test his pupils, that they're equal in size, reactive to light, and that they accommodate the light. I'm also going to check the red reflex. So I'm going to ask you to stare at that light switch right there. I'm going to put my hand in the middle of his face. Move the light inward. Okay, they both react to light. They're equal in size, about 3 millimeters. Then I'm going to check his red reflex. Keep staring at that light switch. Okay, the retina is intact. It reflected a red light, and I don't see any cloudiness or any dark spots in the back of his retina. And so next is oculomotor, number 3, and I will also test number 4, trochlear, and number 6, abducens. And I'll do this with the 6 cardinal gazes. So I'm going to have you not move your head, but look at the pen light and just follow the pen light with your eyes. Okay, I'm not noting any nystagmus, and he was able to follow my pen light in all directions. Next is the trigeminal, number 5, cranial nerve. And I'm going to have you open your mouth, close your mouth, clench your jaw. All right, good to go there. Next is the facial nerve, cranial nerve number 7. All right, I'm going to have you raise your eyebrows. Okay, smile, frown, show me your teeth. All right, all of his facial features were symmetrical. He was able to make all of those movements. Next is the acoustic nerve. I'm going to do this with a whisper test, so that is going to test for his hearing. All right, so I'm going to have you cover this ear, and I'm going to whisper 3 words, and I'm going to do this to where he cannot see me. A, B, C. Can you tell me what you heard?
A, B, C.
All right, can you cover your other ear? And I'm going to test this ear.
1, 2, 3.
All right, very good. So after cranial nerve number 8 is cranial nerves number 9 and 10. That is going to be the glossopharyngeal and vagus nerves, number 9 and number 10. And I'm going to do this by having you open your mouth and say ah. All right, his soft palate rose, his uvula is midline, and while your mouth is open, I'm going to be looking at the mucosa. It is all pink. Can you smile for me? All right, his gums are pink as well. His teeth are straight and they're clean. I don't see any cyanosis. There's no bleeding. So next, we're going to do cranial nerve number 11, and that is your spinal accessory nerve. And so I'm going to have you shrug your shoulders, and don't let me press down. Shrug your shoulders.
Like this?
This is shrugging. Yeah. All right, very good. He was able to shrug his shoulders. And next is the hypoglossal nerve. And I'm going to have you stick out your tongue and say light, tight, and dynamite.
Alright, I.
All right, he's good to go there. Okay, and so I'm going to, I know I already did acoustic, but while I was doing that, I could have looked in his ear. I do not have an otoscope. I would use an otoscope to look into his ears because I would be checking the ear canal and making sure that there weren't any obstructions, excessive earwax, exudate, and then I would shine the light into his ear and be able to observe the tympanic membrane, which should be a pearly white color. And on the left side, this is his right side. On his right side, the cone of light would be at 5 o'clock, and on his left side, the cone of light would be at 7 o'clock. So also, while I'm at his ears, I'm palpating for any tenderness. Do you feel any tenderness?
No.
His ears are the same color as the rest of his body. Also, they're symmetrical with and equal size with his face. I'm doing a general inspection of the skin, and it is a tan color, a light tan color. I'm not noting any lesions or ulcers or bumps, nodules. I'm looking at the back of his neck. His skin is intact. I'm not seeing any erythema. Next, I will inspect and palpate his head and look at his hair. His head is normocephalic. It is round. I'm not feeling any bumps or nodules on his head. I'm going to inspect his hair. It is thick. It is blonde. He doesn't have any scales or any vermin. I'm not seeing any lesions in his hair. So that looks very good. So I don't know if I said it before, but all of his facial features are symmetric. Okay, next, I'm going to palpate his neck. I'm going to make sure that his trachea is midline, that is easily displaced. I'm palpating for his thyroid and it is not palpable. Next, I'm going to palpate his lymph nodes. We have the preauricular here, we have posterior auricular, occipital, submental, submandibular, jugulodigastric. And while I'm at jugulodigastric, I'm going to have you open and close your mouth. And close, clench your jaw. And there was no rigidity or crepitus there, and no rigidity or crepitus with his trachea. So after jugulodigastric, we got superficial cervical, we've got the deep cervical chain, we have posterior cervical, and we have supraclavicular. Okay, all of his lymph nodes are, did you note any tenderness while I was palpating those?
No.
Okay, no tenderness there, and I didn't feel any hardness or any nodules whenever I was doing that palpation. So next I'm going to check your patellar reflex. I'm going to have you scoot back a little bit on the bed there so your feet are kind of hanging down. All right, I'm going to hit your patellar reflex. Maybe you should, I don't know, scoot forward.
Should I take off?
Can you clasp your hand behind your knee like that? There we go. All right, that was a +2, and that patellar reflex is intact. Next, I'm going to check for his plantar reflex. Okay, I'm going to have you I'm going to pull your foot up like this, and I'm tracing from the heel across the all the way up to his pinky toe on the pads of his toe, on his, the upper pad of his foot. Relax. You relaxed?
I'm completely relaxed.
Nothing's happening. Okay, his toes curled inward, and that is an indication of a negative Babinski sign. If his toes had fanned out, that would have been positive, and that's only normal up to 6 months of age. So now I'm going to palpate all of your peripheral pulse points. I'm going to palpate both sides bilaterally, and I'm doing carotid one at a time as to not instigate any syncope. Next is the brachial after carotid, and then radial, and I'm doing this bilaterally. I'm also noting the temperature of all of his extremities are warm, and I'm palpating the skin. The skin is smooth, it is moist, but it's not excessively moist, and it's not dry. I'm doing this bilaterally. After the radial pulse would be the femoral, which is right here, then popliteal behind his knee, and then dorsalis pedis on the top of his foot, and then the posterior tibial, which is on the inside of his ankle here. And all of his pulse points were a +2. Did you note any tenderness while I was doing that?
No.
All right, sounds very good. Next, we're going to do a Romberg test. If you want to go ahead and stand up. Okay, I'm going to have you close your eyes. All right, very good. He's not swaying side to side. He's able to maintain his balance while he's standing upright. Next, I'm just going to have you walk that way. And I'm going to... Oh, you can open your eyes now.
Okay.
Yeah, you can open your eyes. And yes, just take a few steps, 3 or 4, and then walk back. Okay, his gait is steady. He's not swaying side to side. Okay, next I'm gonna have you do a heel to toe. You can just do like 3 or 4. Heel to toe.
Is that,
This is heel to toe.
oh, okay.
Okay, he has very good balance on the heel to toe. No swaying side to side. Okay, next I'm gonna have you do rapid movement. And you would do this like that. Very good. You can sit back down. Okay, he's very well coordinated. All of his movements are voluntary. All right, next we'll assess musculoskeletal. So I'm gonna have you, you can go ahead and stand up again one more time, sorry. Okay, I'm gonna have you abduct your arm. You can just do one arm. You're going to abduct, then you're going to adduct, then you're going to circumvent. Okay, sounds good. I would have him do this bilaterally on all joints to assess range of motion and whether or not there was any rigidity or crepitus or anything like that. You can go ahead and have a seat again. So that was musculoskeletal. Okay, you got your head. Got your eyes. I'm going to palpate his frontal and maxillary sinuses. Feeling any tenderness?
No.
Okay, any tenderness?
No.
Okay, I'm going to palpate his lacrimal apparatus. Tenderness?
No.
Okay, there's no discharge. I'm going to look at your conjunctiva. Okay, his conjunctiva is pink and moist, and his sclera is white. His irises are continuous throughout in color. They're about a blue-green color, and also I'm not noting any erythema or redness in his face. Did your nose, did your ears, did your eyes, did your head. Okay, did your hair, skin, and nails. Musculoskeletal, cranial nerves. Okay. So next we're going to move on to the heart. I would like you to remove your shirt. Okay, I'm going to inspect the thorax and the chest. I'm not seeing any deformities. Everything is symmetrical. He is not in a state of respiratory distress. He's not using accessory muscles to breathe. He has bony prominences that are normal and symmetrical. I'm noting the skin on his back. He has 2 moles and a few freckles, and he does have a laceration that looks like it's healing. It does not appear inflamed, and the skin on his back is all continuous. There are no nodules or bumps or ulcers. Okay, all right, so after inspecting, I'm going to palpate the chest, noting for any masses or nodules. I could go ahead and do a breast exam. So with doing a breast exam, I would go in a vertical striped pattern, rotating my fingers. Let me know if you feel any tenderness. I'm going to have you pull your arm out like this a little bit. I'm going to palpate the tail of Spence. And there's no bumps, no nodules. And then I would do that bilaterally. I'm going to note for the heart that the right side is anterior and the left side is posterior. And the apex of the heart is at the 5th intercostal space at the mid-clavicular line, and the base of the heart is on the right sternal border. And so after that, I'm going to palpate it. I'm going to auscultate the heart now. And I would have my stethoscope in, but in order for me to hear myself talk, I'm just going to put it around my neck. I'm going to use the diaphragm of the stethoscope. And first, I'm going to locate his right second intercostal space. This marks the aortic area. And in the aortic area, I'm going to hear S2 the loudest. That is the sound of the semilunar valves closing. And then I would move to the right, on my right, which is on his left side. And in the second intercostal space is the pulmonic area. And then I would move down to the third intercostal space on the left side, which is Erb's point, where I can hear S1 and S2 together. And I would be listening to make sure that there is a normal rate and rhythm. Next, I would move down to the fourth intercostal space that is at the left sternal border, and this is the tricuspid area. And then I'm going to move down, and the midclavicular line in the fifth intercostal space is the mitral area, and in the mitral area I'm going to hear S1 the loudest, which is the sound of the atrioventricular valves closing. So I've auscultated his heart, and I'm noticing that there aren't any extra heart sounds, no murmurs, and that there's a normal rate and rhythm that I'm hearing. So after auscultating the heart, I'm going to move to the lungs, and for the lungs, I'm going to note that the right lung has 3 lobes and the left lung only has 2, and that's because of the location of the heart. And the lobes themselves at the fourth intercostal space, midline is going to mark the top of the one of the borders of the upper right lung, and then in the fifth intercostal space down here is the area of that also divides to the second lobe of the right lung. And then on the left side, the fourth intercostal space, midline to the fifth intercostal space, laterally, that is going to be the division between the left upper and the left lower lungs. So I've palpated the chest. I've also noted that he's not in a state of respiratory distress. He is respiring at a rate of about 14 breaths per minute. I've inspected, I've palpated. I'm going to percuss the lungs now, and I'm going to be checking over the lungs themselves. You should hear tympany, which is going to sound like a hollow sound over the lung tissue. And I would do this with 2 fingers, and I would tap on those 2 fingers. I would do this bilaterally and in a zigzag pattern in 5 areas on the front. So 1, 2, 1, 2, 2, 3, 3, 4, 4, 5, 5, and in those areas. Next, I'll percuss the back. I've already inspected and palpated the back, and you want to turn your back towards the camera a little bit. Okay. So there are 9 areas bilaterally on both sides, and I'm going to be going in a zigzag pattern. I was hearing everything that I should have heard. Next, I'm going to assess tactile frimitus. You're gonna turn away. Sorry. Okay, so with tactile frimitus, I'm going to be listening for a vibration, or I'm going to be feeling a vibration. When you say, you're going to say 99 every time I move my hands. Okay, so
99, 99, 99, 99, 99, 99.
all right. On his back, everything, I was able to hear that tactile frimitus. There weren't any signs of decreased tactile frimitus. Next, I'm going to auscultate the lungs, and I'm going to do auscultation in each of the areas that I percussed. And so when I'm auscultating and percussing, I'm avoiding any bones like his scapula. So I would not be able to hear very well over those areas. So I would be listening for a full inspiration and a full expiration. So he would have done a full inspiration, and then I would do the same thing on the back in all of the areas that I percussed. So next I'm going to check for equal chest expansion. You can just, well, yeah. So I'm going to have you take a deep breath. Okay, both of my hands moved equally when he did that. So I think that does it for the lungs. I would also note that in the bronchial area, I would hear harsh tubular sounds and that are a little loud pitched. And then in the bronchiovesicular area, it would kind of be a moderate sound in between the vesicular, which would be a more soft rustling sound. Also, when I was auscultating, I did not hear any cracks, wheezes, or rales, no adventitious lung sounds, and everything sounded very clear. I also need to check the AP diameter, which should be 2 to 1. Oh, you're fine. Okay, his AP diameter is 2 to 1. So we're going to backtrack a little bit. I forgot some things earlier. So I'm going to check for edema around his ankles. I'm going to press my index finger in, and there shouldn't be any indentation, and there isn't any bilaterally. Also, when I was palpating earlier, did you feel any numbness whenever I was touching your extremities? And he is able to move everything, so there isn't any paralysis. Next, I'm going to check capillary refills and take inspect his nails. Can I see your nails? Okay, all of his nails are clean. They're well trimmed. The nail itself is translucent, and the nail beds are pink. And I'm going to assess capillary refill bilaterally. And it blanched and returned to normal in 1 second. Capillary refill is good on that. I'll check capillary refill on his toes. I also would like to assess, can you close your eyes and tell me if this pain is sharp or dull?
Dull.
Compared to this?
The second one was duller.
Okay, so the second one was with the eraser, and then the first one was with a very blunt pencil. So does that feel?
That's sharper.
Sharper, okay. And then I would assess that bilaterally. Also, can you feel this?
Yes.
Okay, I'm checking light touch with a cotton ball. And also, can you tell me if this is high or low? Close your eyes. High on your arm or low on your arm?
High. Low.
Okay, very good. Okay, all right, we can probably move on to the abdomen now. So for the abdominal assessment, I'm going to have him lay down. Okay, and then bend your knees. Okay, I'm going to inspect the abdomen first. His abdomen is flat and it is symmetrical on both sides. I'm not seeing any hernias, any lumps or masses. I'm not seeing any I'm not visualizing any peristalsis. And so after inspecting the abdomen, I'm going to auscultate because I don't want to palpate first in order to, I don't want to stimulate any false bowel sounds. So I'm going to start auscultation in the right lower quadrant. And I'm going to listen for a minute at least to note whether or not they're hyperactive or hypoactive bowel sounds. Normal active bowel sounds are about 10 to 30 sounds per minute. If I did not hear anything in that specific quadrant, I would listen for a full 5 minutes before noting no bowel sounds. And after the right lower quadrant, which is where the ileocecal valve is, and there almost always sounds present there. After that, I would move to the right upper quadrant and listen, and then the left upper quadrant and listen, and then the left lower quadrant and listen. And before noting a physician on no bowel sounds, you must listen to each quadrant for 5 minutes at least. So after his bowel sounds, well, I didn't auscultate, but like I said, between 10 and 30 sounds per minute. Next, I would move on to palpation, and with palpation, I would start in the same area in the left lower quadrant, the right lower quadrant, and then move to the right upper quadrant, and then the left upper quadrant, and then the left lower quadrant. As you can see, so I don't know if you can see, but when I'm palpating each quadrant, I'm moving like this to feel. I'm going to note that in the right lower quadrant, we have our cecum and appendix. In the right upper quadrant, we have our gallbladder and our liver. In the left upper quadrant, we have our stomach and our spleen. And then in our left lower quadrant would be the part of the descending colon and the sigmoid colon. After palpating the stomach, again, not noting any hernias or tenderness, if you would feel any tenderness, you would let me know. No masses or nodules, and like I said before, all the skin is intact. And after that, I would percuss. I would also move in the same pattern as I did with auscultating and palpation. I'm supposed to hear tympany over more hollow organs such as the stomach and the intestines. And I'm doing this with, and I would hear dullness over more dense organs such as the liver. Okay, that is it for abdominal. Would you like to sit up again? I would like to palpate your costovertebral angle. I'm going to turn your back a little bit here. So for the costovertebral angle, you're going to tell me if you feel any tenderness when I do this.
Nope. No.
Okay, that is good. So I'm going to tell you how to do your own testicular exam. You're going to want to do your testicular assessment and your breast assessment. It is important for guys to do breast assessments because they can get breast cancer. And also, always checking the tail dispense, which is in your axillary area, pretty much your armpit. And so for the testicular exam, you're going to want to do this once a month. It's good for you to do it either during your shower or after your shower because things are a little bit easier to feel. It's a little bit softer. You're going to put your 2 fingers in the front and your thumb behind, your index and your middle finger, and your thumb behind, and you're going to kind of move in a circular motion but in a vertical striped pattern across your testicle. And you're going to be noting any masses or nodules, any tenderness, any abnormal tenderness. And if you ever have blunt force injury to your testicles, you need to notify your doctor, and also notify your doctor if you know, you find any nodules or masses. And also you have some structures in your testicles that are palpable, that are normal, but they should feel spongy, such as your epididymis, which is more anterior, more towards the front, and then as you move posteriorly, you can feel your vas deferens and stuff like that. But you want to definitely start doing this at your age now, once a month, and it should be good. Okay, so I think that does it, Ransom. Thank you so much for your time today. I'm going to return the bed to its lowest position. You can go ahead and put your shirt back on and get comfortable. Thank you so much for letting me do your assessment today. And I'm going to assess for further needs. Is there anything else that I can get for you?
No.
Okay, I'm going to make sure that his call light is within reach. And I will be back in about 30 minutes to check on you and make sure everything's still going okay. I'm going to dispose of my PPE properly. I'm going to wash my hands. And then I'm going to document. All right, thank you so much for watching.